People who receive opioid substitution in Canterbury number around about 1,000 in total. They are people who are receiving this long term, often for many, many years at a time.
Opioid substitution therapy has historically been a paper-based prescribing service. What this means in practical terms is that a clinician has to sign a quadruplicate piece of paper.
In a client's experience, it's very, very difficult to do what you and I might see as normal, such as going away for the weekend or going to a place where there was no provider. They may need to plan it well in advance, and in some cases they may not even be able to attend. It's about opening up a pathway that allows more flexibility for the client to determine how best their help needs are met.
Improving the opioid substitution therapy service for Canterbury required a system-wide approach to ensure we reach success. Within the Canterbury Clinical Network, both the Pharmacy Service Level Alliance and Mental Health Workstream identified an opportunity to demonstrate the use of an electronic charting platform solution to support the opioid substitution therapy that is provided within Canterbury. The key outcomes that we were leading towards was to decrease the administration, so therefore to free up and better use the time of our wonderful clinicians and their skills. And we also wanted to increase collaboration to ensure that the CORS service and community pharmacy were working to the best ability for their shared client base.
MediMap has a really strong clinical leadership team with many years experience in community supply of medications and knowledge through the whole supply chain. And the whole aim was to create transparency throughout the system for all people involved, all health professionals, and also to enable the clinicians to have more time spent with the client rather than managing the supply via these dot matrix prescriptions. So we knew there were time efficiencies there that could generate better outcomes for these clients. And because of COVID, it demonstrated just how important transferring these systems from paper-based to a digital system actually are. The COVID lockdown proved that digital was the way to go. There was no interruption to services, and things just carried on as normal. So the software can be used by all clinics that provide services to clients on the opioid substitution therapy program.
So what we've seen across the project is that the staff involved at CORS were saving an average of around 13 minutes per client. So if we take that and think about it across a year and across the entire service, the demonstration project suggested maybe 2.8 full-time equivalent has been identified to reinvest into the service for clients who perhaps need a little bit more support for them going through this particular journey. So a wonderful thing about the electronic charting platform solution is that all clinicians involved with a client's care can see everything about the prescribing and dispensing in real time at any time in different locations across the service.
They have the ability to send information, notes, and both ways between the provider and specialist service, and also from the client. So we see the benefits on a number of levels. One is it should be safer for the client. It should be easier for the clinician to actually prescribe, and it should be easier for the pharmacy provider to see what has been prescribed and what has been delivered by the providers previously. But most importantly, it should be a system that allows for greater flexibility for the clients within the predetermined levels or permissions that have been given by the prescriber or for the service. But we're pleased with where we've got to this point now, and we do think it is an improvement on what exists currently. There is some extra work for some parts of the system, but the safety aspect I think has been achieved. The clients themselves at this stage may not have noticed a huge difference other than maybe more seamless scripting that may be occurring. But we're hopeful that groundwork has been done now, and within our electronic charting solution that we can actually start to give the client greater flexibility and more control over their own health.
The demonstration project proved to us that we had a sustainable and scalable model that we could roll out across Canterbury.